Today, I'll show you how to check for unilateral pelvic rotation at home and how to start addressing it right away. But first, what is unilateral pelvic rotation and why should you care? Unilateral pelvic rotation means that one side of the pelvis is rotated forward or backward compared to the other side of the pelvis. This often happens due to muscle imbalances, repetitive movements, or postural habits, especially common in runners or people who sit a lot. When one side of the pelvis is rotated, it throws off your body's alignment. This can cause chronic low back pain, hip pain, butt pain, functional leg length differences, and can even cause knee or foot pain. Unchecked, these issues can make movement less efficient, increase injury risk, and impact your running and daily comfort. Let's start with a simple assessment to check if one side of your pelvis is rotated more than the other. You'll need a mirror, a marker, or two stickers. We'll start by identifying your two ASISs, which will be the most bony prominence towards the top of your hip. Here's the right and the left. Next, place stickers or a marker where each is and compare which is higher or lower. In my case, the right ASIS is sitting higher than the left. Now for the corrective exercise if your right hip bone is sitting higher than the left. Doing right hip flexion and left hip extension at the same time help bring your right hip bone back down and into balance. Since your right ASIS is higher, we want to use your right hip flexors to lower that side and your left glutes to stabilize and gently raise your left side, restoring a more level, comfortable posture. If you found that your left hip bone is sitting higher than the right, then we'll do the opposite action, actively flexing your left hip, bringing your left knee up, and extending your right hip by pressing your right foot down into the ground. This coordinated movement works to lower the left side of your pelvis and lift the right, helping to realign your hips. I've shown two variations, one where our hips remain on the ground and the progression where you bring your hips into the air for added benefit. Perform this exercise for 10 reps, hold each one for 5 seconds, and repeat for 3 sets a day. This is great to build into your morning routine or into your warm-up.